What is up, guys? I'm Tyler Rich. I'm a marriage and family therapist, and this is my channel all about helping answer questions and helping you live a richer, more fulfilled life. In today's video, I'm going to talk about what to expect before and during your first counseling session. The first thing you might be asking is, do I need counseling? I had another video that I'll link to in the bubbly over here on what are some common reasons why people go to counseling. But if you're on this page and you're checking out this video, maybe it's okay to say you could go to counseling. It doesn't hurt just to go and talk to somebody to see if it's right for you. Sometimes it might even take you talking to one or two different therapists to see if it's right. But before we get that far, let's walk through what to know when you get ready to go see a therapist. So questions you might want to ask yourself to begin with is, do I want to drive very far? Does it matter if I see a man or a woman? Does it matter if they're a Christian counselor or they're not a Christian counselor? What type of training do they want? Do they have a specialty? I want to see somebody who works specifically with my type of problem? All of these are good questions. Most therapists have this umbrella where they can work with all clients. So as a marriage and family therapist myself, I can see individuals, couples, families, kids, anything under the spectrum. In every state will have different requirements on who can see what. It's going to be important to ask the therapist if they treat your type of problem. Depending on how you find your therapist will depend on how you can book the session. Most people will use Psychology Today as a way to find a therapist. There's usually hundreds of different therapists, so it might be hard. Sometimes you can check out their website, but most of the time you can pick up the phone and give them a call, and they'll give you a call back if they don't pick up immediately. Or you can shoot them an email, or you can even book, like with me, through the therapist's website. No matter how you decide to book a session, there are a few questions that you might want to ask as you call them. First, you'll want to ask, what is their pricing? How much do they charge for a session? Is it something you can afford? Is it something that you can afford on an ongoing weekly or bi-weekly or monthly basis? There's lots of different options out there for therapy in price ranges, from free student therapy to discounted therapy, all the way up to therapists who've been working for 30 years charging over $200 an hour. So there's tons of options out there. You have to find what's best for you. You want to ask to see if they take insurance. Some therapists will take lots of different insurance. Sometimes they can refer you to somebody who does take insurance. The one thing to keep in mind if you decide to charge your insurance, that most insurance companies require some type of mental health diagnosis. One thing, since I don't take insurance, I tell my clients if they would like to ask their insurance if they can do reimbursement, I can create a bill for them so they can send it into their insurance later. That's an option too when it comes to insurance payments. One of the last most important things is timing. Do they have an office on your side of town? When do they see clients? Do they only see clients on Monday through Thursday in the mornings, and that doesn't work with your schedule? Finding a therapist who has some availability that fits your needs is important, because you're looking for somebody you can work with on an ongoing basis. If you have to rearrange your schedule to meet one time, it might not be the best therapist for you. So finding that ability to connect with somebody on an ongoing basis with your schedule will be important. Show up 10 to 15 minutes early. Some therapists will have you fill out all their paperwork before you start your first session. Some sessions will last 45 minutes to an hour. Others might last a little bit longer depending on where you go. I actually have all my clients fill out all their paperwork before they even get to the office, so when you arrive, we can get started immediately. So one of the first things that you'll do once you get back into the therapy office with your therapist is go over something called an informed consent. Every therapist will go over this slightly different, but it's one of these things that all therapists should be doing. The informed consent will cover a lot of different things. So usually we'll talk about what to expect from working with your therapist, how to contact your therapist in case of an emergency. We'll also talk about what the cancellation policy is, what is the pricing of therapy, how to schedule sessions, all the nitty-gritty and paperwork side of running a session. Everything you say in the therapy office is 100% confidential. Even if I saw a client out in public, I always tell them I'd smile at you, but I would never approach you, let anybody ever know that you're my client. Some of the limits to confidentiality include any suicidal thoughts, homicidal thoughts, child abuse, or elder abuse. It's important to ask your therapist questions about your state-specific laws regarding confidentiality. If you want to see what an informed consent looks like and other policies that your therapist might have, feel free and click the links below, and I'll add mine so you can see what they look like. Once you get all that paperwork stuff out of the way, your therapist will go into understanding what brings you in. Usually we'll say, what brings you into therapy today? And we'll start to go and have a clear understanding. What is the problem? When did it start? How long has it been going? Tell us things outside of the problem. How do you interact with other aspects of your life? And the last thing we usually do in that first session is try to establish some type of goals or something you want to work forward to if you decide to continue doing therapy. Ask questions. If you don't understand something about the policies or something your therapist says, ask a lot of questions. Seek understanding. The goal is not just to understand what your therapist is saying, but to develop a way to understand and know yourself better. You also need to be honest. This means sharing the full story, telling the whole truth, being honest with yourself and with your therapist. Your therapist can't say anything to anybody, so it is one of the safest relationships you will ever have. I always tell my clients they need to trust the process. Sometimes what you have to do is take that leap of faith, and if your therapist is offering suggestions or homework assignments or books to read, take the leap of faith and try doing something that you wouldn't normally do. You might realize you really like it. Do your homework. I give my clients tons of different homework. I could sit back and probably solve a lot of problems immediately. Like, if you just did these things, your problem will be solved. It's not about that. It's about you learning the new things that work in your life. A lot of that time, that comes with doing homework. Sometimes in couples, it means going on a date night. Sometimes if you have anxiety or depression, it means getting up and starting an exercise routine. There's lots of different things that you can do to really enrich in your life, but it starts with you taking that active step and doing your homework. I'll watch the clock. You don't have to worry about looking at the clock every 5 minutes to see if the session's over yet. I'll completely manage the time. I usually tell all of my clients, okay, about 5 to 10 minutes before we're done, and we wrap up from there. You can just be really present in the moment and not worry about the clock. Our job is to fully understand you. So what that requires us to do is pay attention. Sometimes some of us take notes, some of us don't take notes. But what you'll usually hear from a therapist is us paraphrasing or repeating back saying, is this what's going on? Is this what it's like for you? And if you don't feel like we're connecting to you or we're not really getting your problems, slow us down, because that's our job. We have to understand you. We have to be there with you. We need to understand what the problem is before we can help you find the solutions to get unstuck. Let us handle the office time. I always try to get my clients to schedule sessions, do payments, and everything else at the beginning of session, so that way we can just dive deep for the remainder of the time and talk about what brings them in and what we're working on for that day. Every therapist will have their own way of doing things, so you'll find the routine with your therapist. I put together a quick little fact sheet on questions that you can ask your therapist and things to think about before you go to therapy. You can get them in the links below. If you know somebody who really needs to go to therapy but they're really nervous, feel free and share this video with them and encourage them to get the help that they need. If you have any questions or comments or suggestions for future videos, feel free to leave them in the comments below, and I'll be glad to get to them as soon as I can. Hi guys, thank you so much for watching this video today. I really appreciate the time. Feel free, you can like any of the stuff that's going on for my podcast and my Patreon page. Anything that can be helpful. If you have any suggestions, feel free, you can email me. My link is in the thingy thing below. And that's it. So good, these outros. Booyah.